Right. So in this demo class, I'll be taking a small topic, right? A topic which is important as far as your exam is concerned, right? After that, we'll take few questions from that topic. Then I'll explain to you regarding the syllabus, right? DHA, whatever your people are going to write, right? Then how many questions will come, right? And how many hours your exams will have, how many attempts you have got, everything we will discuss. And finally, you'll be given time to ask questions, right? So hope it's clear, right? So before we start, I would like to know where Samson is from. Yeah. No. Right. So we'll start anyways, right? Okay. So I'm going to take the topic pharmacy ethics. It is an important topic, right? So pay attention, right? So what is pharmacy ethics? So it tells you, the principles and morals that you need to follow when you are in your profession, right? So when you are doing or working as a pharmacist or clinical pharmacist, right, in a hospital or in a community pharmacy, there are certain things that you have to follow. There is a behavior that you need to what follow. At certain times, what happens is you are in a dilemma. What is right and what is not right? In such situations, what to do, right? You may have a doubt, na? Right? So, pharmacy ethics will help you take a right decision. Okay, so I'll give you an example. Suppose a patient comes and says that he's having a disease. Suppose, okay, patient is having a disease and he says no to the medicine. Okay, he said, I will not take the treatment, suppose, right? So, is it good or bad thing? But you need to treat the patient, and taking the treatment will do good to the patient, right? But as a pharmacist or as a healthcare professional, can you force that person to take the treatment? Can you do that? Now you are in a dilemma, na? Right? Whether to force the treatment on that patient or not, right? So there comes the importance of principles of pharmacy ethics, which is autonomy. That right? So what is autonomy? It is the patient right to make his own decisions, right? So what is our duty uh, as a pharmacist or as a healthcare professional? It is to just tell him what are the benefits of taking the treatment, right? And what are the disadvantages, right? If you take the treatment, what are the side effects that he is going to have, right? And what are the advantages, right? So that you have to tell the patient. And even if it is a life-saving treatment, if he says no, you cannot force any treatment on that patient, right? So that what right of the patient is called what we call that, right? It is autonomy, right? What is that? Autonomy, right? Then we go to something called beneficence. Now what is beneficence? Beneficence is the quality where you treat the patient in with a belief that you're going to what benefit the patient, right? So you will take any decision to benefit the patient. That is beneficence, right? So autonomy, the patient has the right to make his own decisions, right? What is beneficence? It is to work for the benefit of the patient, right? Benefit of the patient. So for example, if you have multiple drugs available, you will choose the one that will have the least side effect, the one that is most efficacious, right? So that is what is your aim there. It is to benefit the patient, right? You will choose the most cheapest one, right? Now what is non-maleficence? Non-maleficence means you should not harm the patient knowingly, right? You should not harm the patient. So based on this principal question has come there, they said a pharmacist a pharmacist dispensed isotretinoin, okay, a drug to a pregnant woman. Now we know isotretinoin is a drug which comes under pregnancy category X drug, means it is contraindicated in pregnancy, which can cause fetus malformation. Yes, so you should not dispense such a drug, right? And pharmacist, what he did, he dispensed that drug isotretinoin. So which principle he did not follow, right? So answer will be what? Answer will be non-maleficence. Understood? Right. So what is the meaning of non-maleficence? It is to do not harm the patient, right? Do no harm, right? And then comes justice. Justice is what? Treating all the patients equally fairly. Okay. Doesn't matter. A old patient comes to you, right? A young patient comes to you, a Indian patient comes to you, a Pakistani comes, a Bangladeshi comes, or a patient from America, wherever, right? Or a black patient comes, a white patient comes, right? Doesn't matter. You have to treat all of them what? Equally, right? A rich one, a poor one, doesn't matter which nationality, which gender, right? Which race, you have to treat all of them what? Equally, right? Equally. That is justice. So, what are the four core principles of ethics? First one is autonomy, that is A patient has the right to decide for himself whether he wants the treatment or not. Yes. So you cannot force anything on the patient, right? Second one is you have to work to benefit the patient. So if you have multiple treatments available, suppose the patient can have multiple treatments for a single disease, right? So you will help him choose the best one, right? So that is what you're trying to what you're acting to benefit the patient. So that character or that quality is called beneficence. What is non-maleficence? Do not harm the patient. So there we took an example where pharmacist dispensed isotretinoin. So what he did, he harmed the patient knowingly, right? So he gave isotretinoin to a lady who was pregnant, right? So which ethical principle he did not follow? Non-maleficence, right? What is justice? You have to treat everyone equally. Understood? Apsia, clear? Fatima, Shifa, clear or no? Yeah, right. So we don't speak, how will I know? Okay. Next is rules of ethics. Okay. So what we saw now is core principles of ethics, right? Next is rules of ethics. First one is confidentiality. Okay. Confidentiality means any information you have of the patient is very confidential. It is private. You should not share it with anyone. Okay. That is the meaning of confidential, right? So any information you have, the patient's age, right? Patient's name, address, right? What disease the patient is having, right? What type of disease he is having, what drugs he is taking, right? Whatever information you have now regarding the patient is what? Confidential, right? And you should keep it private. You can share it only when the patient allows you to share it. Okay, so patient, if he gives you the consent to share it, then you can share, otherwise you cannot, right? So only those people who are in direct care of the patient, they will have the access to patient information, right? So patient have their records and all, case records, everything. Right. So anybody just cannot come and look into that record. Only those people who are in what? Direct, who are giving care to the patient, like the patient's nurse, right? The doctor who is treating the patient, right? Right. Doctor who is treating the patient, or nutritionalist who is what? Taking care of the nutrient demand of the patient, right? Who's taking care of his meals, everything. So such people only can go through his information. Suppose a doctor from another department comes and says, I just want to go through the record of this patient. Can you show him that? Can you show that information? No, no. But you cannot show him, right? So that is what? Confidentiality. Yes. Next is veracity. Now, what is veracity? You should be honest and truthful with the patient as well as the healthcare professionals. What is the meaning of being honest and truthful? See, when you give a drug, no, you give patient counseling. Yes. So when you give a drug, it is not that you should always tell them about the benefits, right? And precautions that they need to take. You have to tell them about the side effects also. Right, it is there right now to decide whether they want it or not. Right, they should know both the pictures. രണ്ട് കാര്യങ്ങൾ അവർ അറിഞ്ഞിരിക്കണം. Like what? They must know both the stories, no? This both sides of the story. Mean they should know the benefits as well as the disadvantages, right? The side effects, right? So you have to be honest and truthful. You should not exaggerate the benefit. Like benefit കൂട്ടി പറയാ. Should not do that, or exaggerate the side effects, right? Should not do any of these. You should have the uh, a moderate way in which you will be telling the patient, right? So that is veracity, being truthful and honest to the patient as well as to what? Healthcare professionals, right? Who are working along with you, right? Next is fidelity. Fidelity means to be loyal, right? So if you take up a responsibility, no, right? Saying that you don't worry, I'll take up the duty tomorrow night, right? So you have to keep that promise, right? So that is being loyal to one's promises and responsibilities. Or you say that if the nurse doesn't come, I'll make sure that the other guy, I'll inform that, inform the other nurse to get it ready, right? So something like that. If you take up a responsibility, you have to what? Keep it. Yes, that is fidelity, being loyal. Okay, being loyal. That quality, being loyal, is called fidelity, right? Next is accountability. Now, if something happens from your side, okay, any mistakes or anything, right? You have to take the responsibility for that, right? It is not like you should not put the blame on somebody who's under you. Okay, you should not do that. So whatever happens, if it is because of your actions, you have to take the responsibility, and that is what? Accountability. Okay, taking responsibility for one's own action. Okay, action, that is accountability. So what are the different qualities that we studied. First is autonomy. What is autonomy? Taking or deciding for one's own self, no? Right? The patient has that right, to decide whether he wants something or not. Yes, that is autonomy. What is beneficence? Beneficence is to benefit the patient. You have to work to benefit the patient, right? Beneficence, benefit. Non-maleficence, do no harm. Do not harm the patient. What is justice? Treat everyone equally, right? What is confidentiality? Whatever information that you have is what? Private, right? You cannot share it with anybody else. Veracity, being honest and truthful. Yes. What is fidelity? It is being loyal, right? And what is accountability? You have to take responsibility for your own action, right? So if a medication error and all happens from your side, you have to admit that it has happened and take a corrective measure, right? That is accountability, right? Clear, hai? Jatin, clear hai? Jatin. Okay, next is informed consent, right? Informed consent. Now, what is informed consent? Informed consent is something that we take from the patient before we give them a treatment, right? So suppose a patient has to undergo a medical intervention. So before we give them that treatment, we have to get a word consent from the patient, right? And before getting the informed consent, you have to make sure the patient understands everything. Like he knows the risk, he knows the benefits, he knows the other alternatives that are present, right? Suppose somebody you're counseling for chemotherapy, right? So you must tell him the other alternatives if they are available, right? And what is going to happen, okay, once the chemotherapy session is done or any other treatment is done, right? So risk, benefits, alternatives if available, and the likely outcome, right? After doing it, what are they? You have to tell the patient everything, and only after that they will what? You will ask them for their consent, okay? And when they give their consent, it is called what? Informed consent, because they were informed, no? Regarding everything. Yes. Now, who can give you an informed consent? A patient who has the capacity to do that. No? Who has the capacity? Somebody who is mentally stable, right? So if somebody is say having mania or something or psychosis, are they in a position to give you an informed consent? No, right? So if somebody has mental illness, or if they are not conscious, right? They are unconscious, right? Or a child below the age of 18 years. These are the people who cannot give you informed consent, right? So before you get an informed consent, you must disclose everything to the patient, right? So you have to tell them, you have to give them complete, clear, as well as the information should be in an understandable language, right? It's not like if they are some say they speak Arabic and you're telling them everything in English, so they will not understand everything, no? Right? So you have to tell them everything in the language that they understand, right? Right? And you have to tell them about risk, benefits, alternatives, outcomes, everything, right? And finally, they should give you the informed consent based on their own will, right? Voluntariness. What is voluntariness? You should not force the patient for anything, right? It should be freely given, right? Well, we say no voluntary, right? So that is voluntariness, right? So it should be freely given without any correction, means without any pressure, right? It can be from the healthcare professional side or from the family side, no? Right? Family can come and say, no? See, if you don't uh, get the treatment done, we will not talk to you, right? That happens, no? Grandchildren come and force the grandparents to get a bypass done, right? This has happened in many families, yes. So that is what? That is not permissible, right? That should not be done. Patient should take the decision, right? Clear? Yes? No? So we'll take a few questions, okay? After that, we'll move to the syllabus, right? What you have to study and where you have to study from, right? So which are the ethical principles do you violate as a pharmacist when you prioritize giving consultation only to relatives? If you're treating your consultations are being given to your relatives only, you're not paying attention to the other patients, which ethical principle did you violate? Justice, autonomy, beneficence,
Yes,
non-maleficence.
yes,
This one, which one, Abbas?
justice.
Justice. No, you have to treat everyone
Treat
equally.
all equally.
Yes, you should not what give preference to your relatives, right? That is not right to do. Okay, good. A 62-year-old man had a biopsy, okay, confirming pancreatic cancer, right? A pharmacist meets his brother who asked not to inform the patient about the diagnosis. What should the healthcare professional do? So 62-year-old man had a biopsy telling him that, confirming that he has what? Pancreatic cancer, na? Right? Now the pharmacist meets his brother, and what is brother asking the pharmacist to do? To hide the diagnosis from the patient, right? So what you should do as a healthcare professional, that is the scenario, right? So options are, the healthcare practitioner should ask the patient how he wants the information delivered and allow family time for discussion, right? A healthcare practitioner should honor the request of the family member to withhold the diagnosis, right? Don't tell the patient, okay, as the brother requested. That is the B option. Third one, the healthcare practitioner should tell the patient that withholding information is not permitted under any circumstances, right? So you have to tell the patient that it is compulsory for the patient to tell everybody in the family, right? He cannot withhold information, right? The patient should not be told about the diagnosis because of its grave nature. What should be the answer? A, B, C, and D. See, in Gulf exams, na, you don't have any negative mark, right? So you can, but with all fours, you can give a right answer, or you can give an answer. Okay, there's nothing to worry about. Yeah. Anybody? A, B, C, and D. What do you think should be the right answer? See, I have taught you now. I'm reading the question. I should not be reading the answer also. No? ഞാൻ തന്നെ വായിച്ച് ഞാൻ തന്നെ പറയണോ എല്ലാം? വേണ്ടല്ലോ. വേണോ? Who want to take a chance? Come on. Anybody? अब्बास आप ही दे दो फिर.
Option B.
कौन सा? Which
B.
one? B, na? Right? The healthcare practitioner
Yes, ma'am.
should honor the request of the family member to withhold the diagnosis, right? Who has the right to decide for himself? The family member or the patient? Who should write? Who, that is autonomy, na? Children. Autonomy means, in India, what we do? In India, we don't tell the patient, but that is not right. Na? What is right? The patient should know, no? Should know, no? What he is going through. And he is the one who should decide, na? Yes. If I get a grave disease, I should be the one to know it first, na? And I should decide for myself, na? In the whole world, nobody will be as sad as me, right? Knowing that I have a disease. Not even my mother, right? That is the truth, right? So it is the patient right to know what he's having, right? And the correct thing to do is the healthcare practitioner should ask the patient how he wants the information delivered, right? And allow family time for discussion. Understood? Now, if he doesn't want it to be delivered to the family, the pharmacist will respect that, right? And he will hide it from the family. Understood? That's what is right to do. Okay. He's the one who should come to know first. Clear? Okay. A similar situation
Okay, ma'am.
a similar situation that came in exam is a child who is more than 18 years old, right? He or she, right? They go to the pharmacy and they buy a drug, right? And a mother comes behind the child and asks the pharmacist, what did my child buy? Understood? So this is a situation where a child has bought something, right? We can't say child. He's an adult, right? So above the age of 18 years, right? Has bought something from the pharmacy. Mother comes from behind and asks the pharmacist, what did you dispense to my child? Right? So as a pharmacist, do we have the right to tell the mother? Is it correct to inform the mother what the child bought? Okay, keep your emotions aside. Is it correct legally or ethically correct? What do you think? Correct or not correct? Listen, tell me,
We should inform.
we should inform. That's what
We
we
should
feel
inform.
as Indians. Yes, right? That's what our emotions tell us. Na? But what did we say here? Autonomy, na? You cannot, confidential, na? Information is what? Confidential means keep all patients' information private. You will violate it na? If you tell the mother. Child is above the age of 18 years. Understood? Right? So what we think is right, na? We are in a dilemma. That's why I said, na, when we are in a profession, we are in a dilemma, what to do and what not to do. Right? So these rules will tell us exactly what to do in such a situation. Right? So there you're not supposed to tell the mother. Right? Even the father, even the brother, nobody. Right? If the child is above 18 years of age. Right? It is not legally right to tell the parents. Right? So that is the thing. Okay. Understood, na? So that's why these principles are important. Clear? बस clear है ना?
Yes, ma'am.
आप कहाँ
Yes,
से हो?
ma'am.
Where are you from?
Karnataka.
Karnataka. Yes. Right.
From
Next.
Karnataka.
Yes. Now, next question. A 25-year-old man with leukemia is admitted. Who among the following can access his medical records without special permission? Right? Who can go through his medical records, right, without any special permission? Right? We are talking about a 25-year-old man with leukemia. Clear, है ना? Question clear है? Is question clear? So there is a 25-year-old man. Just say yes or no. Right? It will be easy for me to understand ना, whether you people understood or not. मेरे लिए आसान होगा ना कि आपको समझ में आए कि नहीं समझने में ना. Clear है? If you people
Yes,
don't
ma'am.
talk and tell me na where you people are from and what are you people preparing for, I don't know in which language to speak. That's why I'm choosing English. Okay, right. അപ്പോ അൻസലിന് മനസ്സിലായില്ലേ? ചോദ്യം മനസ്സിലായോ?
മനസ്സിലായി.
Yes, right. So patient cousin who works as an outpatient nurse, right? He can go through his record without permission. Who? Patient's cousin, right? Who works as a outpatient nurse. Medical resident in pediatrics, curious about leukemia risk. Clinical nutritionist assigned to calculate the patient's nutritional needs. Pharmacy resident doing research on cell transplant. Who can go through the medical record of this patient without special permission? Who can go through? Patient's cousin, a medical resident in the pediatrics department who is curious about leukemia, a clinical nutritionist assigned to calculate the patient's nutritional needs, pharmacy resident doing research on cell transplant. Who can go through it without special permission?
I think medical resident.
Why do you think so? Tell me
Because he has a valid medical license at least, because a nurse, pharmacist, and clinical nutritionist are not considered as a medic.
And the thing is, see, there is one more thing to note here. Na? Clinical nutritionist is directly involved in that patient care. Na? He has to calculate patient's nutritional needs. Na? Yes. And for that, he has to go through his medical records. Yes. So he's directly involved in that patient's care. Na? Others will have to get a permission from ethics committee. Okay. There's nothing wrong in going through the medical record, but before that, they will have to get a approval from ethics committee. If patients, it is a big hospital, in big hospitals and all where studies actually go on, right? We have an ethics committee. We also call it by the name IRB, Institutional Review Board, right? So you have to get the permission from this board, right, to go through if you want to go through the medical records. Clear? Right. So here the answer is clinical nutritionist. Okay, because he's directly involved in patient care, this patient's care. Clear? So answer is C, right? Last one. This we have taken already. Isotretinoin is contraindicated during pregnancy. A pharmacist knowingly dispenses it to a pregnant woman. Which ethical principle is violated? Justice, beneficence, non-maleficence, autonomy. What he did?
Non-maleficence.
Non-maleficence.
Option C.
C, yes. So non-maleficence means do no harm. But the pharmacist did harm the pregnant women. Yes. So he violated non-maleficence, right? So what is justice? Treating everybody, every patient equally, fairly. What is beneficence? What is beneficence? You should work to, come on, benefit the patient. Non-beneficence, do no harm. Autonomy, patient has the right to decide what he wants. Yes. Okay. Okay, last question. A patient refuses to take a life-saving medication despite understanding all the consequences. What should the pharmacist do? Patient refuses to take the life-saving medication despite understanding all the consequences. What you should do? Can you force? Inform the patient's family and ignore the patient wishes. Administer the medication secretly without telling him. Okay. Now, respect the patient's decision. Convince the patient using emotional pressure. Autonomy. Autonomy, na? Who will decide? The patient will decide, right?
Should respect the patient.
Yes, that is the only thing that we can do, right? We can make him understand advantages, disadvantages, right? The grievousness of his decisions, right? That we can do, but we cannot force him, right? We cannot give him anything secretly also, right? So you have nothing to do but to respect the patient decision. Clear enough? Right? So these type of questions come from your ethics, okay, ethics portion, right? Okay. So the questions that we saw on are what? Always put us in a dilemma, na? What to do and what not to do, right? So you have to learn those principles, right? The 8 principles thoroughly. If you understand those things, that it will be easy, right? So it doesn't matter whether you're preparing for DHA, SPLE, right? Oman, या फिर Qatar, right? Any exam, right? For all this, the basic areas from where questions come are these 4 domains, right? So domains are your basic biomedical sciences, right? Second is pharmaceutical sciences. Third one is social, behavioral, administrative sciences. And fourth one is the clinical sciences. Okay, clinical sciences. In most of the cases, majority of the questions come from the clinical sciences portion, right? Combined with the pharmaceutical sciences, right? So dosage calculations, cross multiplication type, right? Pharmacokinetics type, then your infusion rate type, right? All these things come under pharmaceutical sciences. Little bit of pharmacognosy and pharmaceutical chemistry also come under pharmaceutical sciences. So in DH and all, their questions do come from chemistry area, right? Like they might ask you which is the drug of choice for absence seizures, right? So answer is easy. It is what? Ethosuximide, right? But they will not give you the drug name. Instead, they will draw the structure. Okay, they will give you 4 different structures and ask you which of the following is given in what? Absence seizures. Now you will have to know the structure of ethosuximide. Only then you will be able to answer the question, right? So such things come under what? Pharmaceutical sciences along with certain calculations, right? A little bit of pharmaceutics, right? From tablets, suspensions, right? Questions can come, right? Clinical sciences, you will be given a case scenario, right? Right. And then you'll be asked to what? Deduce the answer from there, right? Basic biomedical sciences, biomedical, biochemistry, meaning biochemistry, genetics, and all. From there, questions come. Social, behavioral, and administrative sciences is what we saw now. Ethics and all come under domain 3, right? So we'll take one question from each of these domains, right, and see how much we know, right? So first question from basic biomedical sciences. I want all of you to participate in this, okay? Otherwise, it is really boring, na? I'm the only one talking here. Okay, fine. Ella, Anselna, Maroof, Abbas, right? Fatima?
Yes.
Yes.
Yes, ma'am.
Okay. Okay. Please participate. Okay. Now, which enzyme catalyzes the conversion of RNA to DNA, an essential step in replication of the retrovirus like HIV? So, retrovirus means HIV has RNA as the virus. Okay, RNA as the genetic material, right? So, what they're asking, what RNA needs to be converted to DNA, right? For that, which enzyme is required, or which enzyme catalyzes the conversion of RNA to DNA, right? So you have 4 options: RNA polymerase, helicase, reverse transcriptase, and DNA linkase. What do you think will be the answer?
I think reverse transcriptase.
Reverse transcriptase.
Yes. Why? Because see, DNA, when it is what? Converted to RNA, what do we get? What is this process called? It is called transcription. Yes, transcription. And when information from RNA gets translated to proteins, we call it what?
Translation.
Yeah, very good. Translation. Yes. So the reverse of this is what? Conversion of RNA to DNA. And the enzyme that catalyzes this is reverse transcriptase. Okay. So answer is what? C. Okay. Good. Now, next is the solution contains from pharmaceutical sciences. Okay. The solution contains 500 parts per million of sodium chloride. What is the concentration of solution in percentage weight by volume? Right. Now, for you to answer this, you must know 2 things, 2 concepts. First thing, what is part per million? Okay, part per million. Part per million means how much gram is present in 10 raised to 6 ml, right? 1 million is how much? We all have now this 1 million subscribers sort of thing right now, right? So how much is 1 million? It is how many lakhs? You can tell me. How
10
many
lakhs.
10 lakhs, yes. So 10 lakhs, a lakh is 1 followed by 5 zeros. Right? Here it is 10 lakhs. No? So it's 1 followed by 6 zeros, which is written as 10 raised to 6 ml, right? So how many gram is present in 10 raised to 6 ml is what? 1 part per million. So this is 500 parts per million. No? That means what? There is 500 gram and 10 raised to 6 ml, right? Now what is the question? What is the concentration of solution in percentage weight by volume? Now, if somebody is asking you to express any concentration in percentage weight by volume, it means they're asking how much grams are present in 100 ml. Okay, so what does this mean? See, X percentage weight by volume means there is X gram in 100 ml. So if it is 5% weight by volume, what is the meaning? There is 5 gram in, come on, 100 ml.
100 ml.
Okay, 100 ml.
100 ml.
It is, if it is 12.5%, it means there is 12.5 gram in, come on,
100 ml.
100 ml. Understood? Right, 100 ml. That is the meaning, right? So they want to know the strength and percentage weight by volume. Means they have told you, see, we have 500 gram and 10 raised to 6 ml. Tell us how many grams are there in 100 ml. Understood? You will get the percentage weight by volume. Okay, now what you have to do, just cross multiply this, right? So X will be equal to what? X into 10 raised to 6 will be equal to 500 into 100. Understood? Cross multiply, no? Yes. So X will be what? 500 into 100 by 1 followed by how many zeros? 6 zeros. Yes.
6 zeros.
Yes, 6 zeros, right? So here it will cut, right? So 5 by 100 is how much? 0.5.
0.05.
Yes, 0.05% weight by volume. Easy, right? But for you to answer this, you must know only two things. What? How much is 1 part per million, right? So you will understand what 500 part per million is, and you need to know what is percentage weight by volume. If you know this, all you have to do is what? Just cross multiply. You will get the answer. Okay, it looks tough, but it is not tough. Clear? Clear? No. Say, children.
Yes, ma'am.
Yes. Just say yes or no or repeat whatever, right? Okay, this we have taken, right, from the ethics portion, right? So this is the answer was what? Non-maleficence, right? What? Isotretinoin given in pregnancy, yes, by a pharmacist. Okay. This is from clinical sciences. Okay. A 72-year-old man with a history of hyperlipidemia. Okay, what is he having? Hyperlipidemia, has been on high dose atorvastatin therapy for past 6 months, right? So he's taking what? High dose of atorvastatin. He's having hyperlipidemia. He also has renal insufficiency. His recent lipid profile shows LDL cholesterol levels, how much? 131. Triglyceride levels, 510, right? HDL levels, 32, right? What is the question? The physician plans to add another medication to improve his lipid levels. Yes. Question is, which of the following can be added? Okay, which of the following is most appropriate to add, right? So what we have to see here? We need to see which parameters are not correct, right? High. So cholesterol, LDL cholesterol is almost borderline. It is okay, right? You don't have to reduce it further, right? Triglycerides, what is the maximum level? See, if it is above 500, it is high risk category. It should be less than 150. Patient is having how much? More than 510. Okay, 510, which is really high, right? And what about his HDL cholesterol? We call HDL cholesterol a good cholesterol. LDL we call it bad. So LDL is bad. Yes, HDL is good, LDL is bad. Why is LDL bad? Why is HDL good? See, it's a simple thing. See, who is the one that synthesizes cholesterol and all? Liver, no? The metabolic factor in our body, right? Yes. So LDL, no? It is, see, these are lipoproteins which carry cholesterol, right? So LDL carries cholesterol from liver and deposits it onto the blood vessel. Understood? Right? So LDL is responsible for atherosclerotic plaques that you see, right? If plaques block the artery, the patient may experience angina, right? Right, block in the coronary arteries, right? So he's responsible. Who carries this cholesterol from liver and deposits it onto the arteries and all? LDL. And what does HDL do? Opposite. It takes the cholesterol from the tissue and gives it to liver. Now, what will liver do with the cholesterol? It can do many things. It can synthesize hormones, no? Testosterone, estrogen, progesterone, adrenal cortex hormones like aldosterone, right? Cortisol, all have cholesterol as precursor, right? So liver can do a lot with cholesterol, right? So that is done by HDL. So we want HDL to be more than 60. Here it is what? 32 only. High risk. Why? It should never go below 35, right? 35. Now, what is our aim here? We have two things to do. What? We have to decrease triglyceride as well as increase HDL cholesterol. Understood? Now, which of the following can do both is the question, right? So you have fenofibrate, niacin, colsavelam, gemfibrozil, and ezetimibe, right? Ezetimibe. Now remember, there are two classes of drugs that can decrease your triglyceride levels. Okay, one is your niacin. Before that, is there anyone who want to? No, ezetimibe you think is the answer? Okay. So somebody has given me E as the answer. Anybody want to try before I go into the explanation?
I think fenofibrate.
Fenofibrate. Yes. Okay.
Niacin.
Niacin. Right. There are people who are okay. Then anybody else? Yeah, your voice is breaking. I can't hear. The one who gave me the answer right now, no? I can't hear your answer. You can put the answer in the chat box. I'll be able to see, na? I can't hear what you're saying. Sorry. हाँ इधर क्या आंसर ना ट्राई जे क्या what do you think will be the answer? Ashfaq, Majid, try करोगे? Wasim, let's see.
Estimate, ma'am.
Acetamide, Majid. Okay. Fenofibrate, you think, no? Okay, right. So the one who gave the answer as niacin is the one who correct. Okay, so let's understand first. So if you have to increase triglyceride levels, there are two drugs that you can give. One is your niacin, okay, which is also called by the name nicotinic acid. Nicotinic acid. It is also called vitamin B3. What?
Acid.
B3. B6 is pyridoxine. Okay, B6 is pyridoxine, it is B3. Okay, niacin, nicotinic acid, vitamin B3, right? So that can decrease your triglycerides. You cannot decrease your triglycerides. Second thing, your fibrates. Okay, fibrates can also do that, which fenofibrate, gemfibrozil. Okay, they come under the fibrate category. Both can decrease triglycerides, but niacin is the only one that can increase your HDL cholesterol. Understood? Right. So that's why niacin is the answer. Why? That's why niacin is the answer. Reason, niacin can increase HDL. Fibrates can decrease triglyceride level. Niacin can also decrease triglyceride level. But we need HDL to increase also, no? Right? So we have to give a drug which can address both the problems. Yes. So in that case, because of that, answer is what? Niacin, right? Niacin. Now, as far as ezetimibe is concerned, it reduces your cholesterol levels, not triglyceride levels, right? So which drugs reduce your cholesterol levels? See, there are three drugs which reduce your cholesterol levels. One is your statins. The first line in hypercholesterolemia, when you have too much of cholesterol, is what? Always statins, right? Statins. Next thing that you can give is what? If you have given maximum dose of statins. Huh?
Omega-3 fatty acids.
Yeah, that is adjuvant.
80 mg.
Right? Atorvastatin 80 mg is the highest dose, right? High dose of statin, right? You cannot increase it further, right? So high dose atorvastatin you have given, right? So you have tried a potent drug in high dose, right? Now even after that, if your cholesterol levels are high, suppose now you will have to add one more drug, no? Right? So will you add what? Usually the drug that is added is ezetimibe, right? So what is the difference between statin and ezetimibe? They both target cholesterol, but statins, they inhibit cholesterol synthesis, whereas ezetimibe inhibit absorption of cholesterol from dietary cholesterol. It is not absorbed, right? So whatever we eat, the cholesterol that is there in our food is eliminated as such in the stool when you take ezetimibe, right? So both have different mechanism, but they address the same problem. But they are targeting cholesterol, right? So something if you want to add after statins, then that will be what? Ezetimibe, right? Ezetimibe. And your bile acid sequestrants like colsavelam can also be given, right? They also lower LDL cholesterol levels, but they should not be given if triglycerides are too high. They are contraindicated in hypertriglyceridemia. So here the condition is that only. No? So no way you can give them colsavelam. Clear? So these are the few things that you need to know. Okay, there's further a lot in this chapter. Like statins, what is the major side effect of statin? Anybody? Question comes. What is it?
Rhabdomyolysis.
Rhabdomyolysis.
Myopathy.
Myopathy. The most common one is myopathy. Severe form of myopathy is rhabdomyolysis, right? So when your muscle breaks down, which enzyme does it release? Anybody? Which enzyme?
Troponin.
Troponin comes from
Cardiac tissues.
cardiac tissues, right? So that you have to
Heart.
monitor if somebody has heart attack. MI, na? Yes, so cardiac specific enzymes are troponin, right? Troponin I and troponin T, right? Here you have to monitor creatine kinase. Which one? Creatine, okay, creatine kinase, okay. Can also call it creatine phosphokinase, right? So that is with statins, okay. Not only with statins, fluoroquinolones, they also cause what? myopathy. Also your daptomycin. Daptomycin is then a cell wall synthesis inhibitor, right? So these three drugs, daptomycin, fluoroquinolones, and your statins. Okay, they can cause what? Increase in creatine kinase levels. They cause what? Myopathy as side effect. Right? Clear? So such type of questions come from clinical side, and clinical side is the most important area, right? If you have cleared clinical sciences, na, just think you will pass the exam. Why? Because majority of the question come from this area only, clinical sciences, especially for DHA, na? DHA, those who are preparing for DHA, SPLE and all, right? A lot of questions na, are based on what? Clinical scenarios only. So when students go and write and come, na, they say, I don't know, ma'am, I got 60 to 70 questions out of 150, I'm saying. Okay, 60 to 70 questions were what? Case-based studies, right? So you have to be very thorough with the what basics, right? So all these that we studied are basics only, right? So if you know small things, you will be able to what answer these questions. Okay, they seem very tough. These values will not be given in exam, right? So there are few values which you have to by heart also, right? That we will tell you when we study each topic. So answer here is what? Niacin, right? Niacin. Right. Now, there's one more thing that we give for free, right? And that is recall-based test, right? Recall-based test. So to get that, now all you have to do is download our app, which is Proficient Learning app, right? And then once you have downloaded it, right, in whichever group you are, na, just mention it that I have downloaded, you will be added to the group, right? Then and there. Otherwise, within 24 hours, right, you will be added to the batch. Which batch? Make sure you're added to Proficient GCC Pharmacist Test batch, right? So this is the batch in which you need to be there, right? So if you are there, when you click on this batch, you will see overview, attendance, right? Assignment and all. Here you can see, no? Right? Just scroll it, right? Swipe it. You will see what test, right? If you click on that, you will see the ongoing test, right? So this is an example, right? GCC Pharmacist, previous questions. You can click on attempt and attend 5 questions daily, okay? Daily, right? For that, you don't have to pay anything, right? You will be added. It is free. You can tell your friends also, right? So every day, Monday to Friday, right? So today is Friday, no? Yes. So today, the time is from 7 p.m. to the next day, 7 p.m. Validity will be for 24 hours only, right? So if you attend it in between that time, you will be able to see it till you have that app with you, right? Right. So you can see it whenever you want. You can go through that, right? You can see the right answers, explanation, everything, right? So that is something that we offer, right? Now, so there are different exams, right? So you have exams conducted by the Dubai, which is DHA. Then we have Qatar, Oman, Ummah, Bahrain, Had, and Saudi, right? Saudi. Now, so if you have any doubt, you can ask. If DHA, as far as DHA is concerned, there will be 150 questions. You will be given a time of 2 hours and 15 minutes. Okay, we usually say it's 3 hours, but actually in practice, you don't get the full 3 hours. It is somewhere between 2 hours 45 minutes to 2 hour 50 minutes time. Yes. Now, what is the pass percentage? If you're writing for pharmacist exam, if you have done B.Pharm, you need to score 60%. If you have done D.Pharm, if you're writing the technician exam, then you need to score 55%, right? Now, for clinical pharmacist, you people need to score 70%. Now, for pharmacist and for clinical pharmacist, the question paper is the same, right? Only the passing percentage is different. Understood, right? The validity, once you pass the exam of DHA is 5 years, and you need not do any data flow for that. Okay, so the advantage of DHA is that you can write it just after you finish your B.Pharm, right? You can prepare for it and write the exam, right? And slowly you can get that experience and get your data flow done. Once your data flow is done, then you can go and work in Dubai. Okay, and one more advantage is that if you go and work in Dubai and feel you don't want to work there, you can convert your license to MOH, okay, or to Had if you want to, right? And go and work in the other Emirates, right? UAE. Right, so this is also possible, right, with DHA, right? But that other exams don't give you that freedom because the validity is comparatively less and you cannot take risk, na? Right? So for Qatar and Oman, you don't need to do data flow, but their validity is not that much, right? Qatar's is 3 years and Oman is only 2 years, right? 2 years. So you cannot take the risk. With DHA, you can because you have enough time. 5 years time is there, right? Then Saudi Arabia, see, technician exam, any Anybody who has done diploma, B Farm or M Farm, they can write the technician exam, right? As far as SPLE is concerned, Saudi Pharmacist Licensure Examination, that is concerned, only PharmD people can write it, right? It is because you need to have a degree, a pharmacist degree, which spans 5 years, right? Without a gap in between, right? So as far as our country is concerned, India, here B Farm is how long? Only 4 years, no? Yes. So that's why we are not eligible to write SPLE. If you have done B Farm, even M Farm, right? Post graduation, we cannot write it. Only people who have done PharmD, they can write it, right? SPLE. Now, there are 210 questions in that, right? It's for our duration. So you will have it in 2 sessions, right? In each session, you will have 105 questions, right? Then there will be a 20 to 30 minutes break. After that, you will have the second session where you will get the next 105 questions, right? So you need to score 536 out of 800. That is a score. So which, if you look at the percentage wise, it is somewhere near to 67%, right? So that much. Once you clear the exam, it will be valid for 5 years, right? So Saudi and all also requires data flow. Okay, it needs to be done before you can actually sit for the exam. Yes, and you need to have 1 year's experience. Okay, for Saudi, it's not 2 years. For DHA, if you want to go and work there, you need to have 2 years experience. Na? Yes, Oman and all 2 years, right? For Saudi, it is only 1 year, either in hospital or in uh, community pharmacy. It doesn't matter, but you need to have 1 year experience, right? Okay. So is there anything that you have any doubt here? You can ask. If you have any doubt, कोई doubt हो तो आप पूछ सकते हैं. Doubt नहीं चाहिए क्या? Doubt? No. If not, I'll move to the next slide. Should I move? Children, no doubt.
Ma'am, is exam exempted for MPharm with 2 years experience for Qatar?
Now, if you have, yes, if you have M-Pharm and if you have 2 years experience, there is no need to write Qatar exam. That is there. Okay, doesn't matter in which specialty you have. If you have a M-Pharm degree with 2 years experience, you don't have to write Qatar exam. There is an
Okay, thank you,
exception.
ma'am.
Anything else, children? Okay. Who used my ask?
DHA ലൈസൻസ് കിട്ടിക്കഴിഞ്ഞിട്ടുണ്ടെങ്കിൽ നമുക്ക് ഹാദിലേക്ക് കൺവേർട്ട് ചെയ്യാൻ പറ്റുമോ?
പറ്റും പറ്റും പറ്റായിക്കൊന്നുണ്ട്. ഹാദിലേക്കും മാറ്റാം, ഇമോജിലോട്ടും മാറ്റാൻ പറ്റും. ഇത് മൂന്ന് നമുക്ക് അങ്ങോട്ടും ഇങ്ങോട്ടും കൺവേർട്ട് ചെയ്യാൻ പറ്റിയതാണ്. കാരണം മൂന്നും UAE അല്ലേ, എമിറേറ്റ്സ് അല്ലേ മാറുന്നുള്ളൂ. ദുബായും അബുദാബിയും അല്ലാത്ത എമിറേറ്റ്സ് എമോജി അങ്ങനെയാണല്ലോ. അപ്പൊ മൂന്നും നമുക്ക് കൺവേർട്ട് ചെയ്യാവുന്നതാണ്.
मैम कतर प्रोमेट्रिक फार्मेसिस्ट एग्जाम ओनली बी फार्मा या एम फार्मा?
नहीं, इट्स बी फार्म मिनिमम क्वालिफिकेशन, बी फार्म. बट अगर आपके पास एम फार्म है ना, तो और 2 साल का एक्सपीरियंस है, तो आपको लिखने की जरूरत ही नहीं है एग्जाम. क्लियर है? क्लियर है ना?
यस मैम.
Anything else? Okay.
For writing DHA, ma'am, what is the date considered? Either the passing year mark sheet of BPharm or the date when we get registered into the respective state pharmacy council?
Registration date is what is considered.
For every Gulf country, no?
No, for DHA it is. For every country it is different. So you tell me the exact thing. Sir will get in touch with you. So we have.
Actually, I passed BPharm in December 2022. But due to immediate admission, I wouldn't register in the State Pharmacy Council. So I registered myself in February 2024.
So from there onwards, they will calculate it.
Okay.
But you can write the exam. See, writing the exam takes 4 to 5 months of preparation, right? If you really are put in your effort, minimum 3 months of time, 3 months time it will take, right? So you can do both, na? Work as well as what prepare for the exam, right? Once you have got the experience, and then if you sit for the preparation, you will be in a hurry, right? Because your experience is done. Now you are in a hurry to clear the exam so that you can go and work there, right? But while you're working, when your experience is not done, you have enough time to prepare. So you will give more time. You can give more time to actual preparation, right? And get it done in first attempt itself. हमने देखा है कि when children, once they get the experience, first thing but there is a big gap between their passing date and when they come for coaching, right? So most of the things they have forgotten, right? First thing, that is the problem. Second thing is that, again, they are in a hurry to clear the exam, and in that they don't prepare much and go and write the exam. And when they do that, the chances to fail is high. Okay, you should never take it easy, because these exams are not easy, right? These are tough. So you have to take it with that seriousness only, right? If you think I have done BPharm, I'll do it, it is easy, it is not. Passing BPharm is way, way, way easier than cracking these exams, right? Because there, that is description type. If you know it's something related to a topic, you can write. You will get the marks and you might pass also. But here it is objective type, right? So either you know or you don't know, right? Either you get the mark or you don't get it, right? So even though the percentage, everything seems very small, right? 60% and all, to get it, it is really tough. Even without negative marks, it is tough. Clear है? Maruf. Up Panshu?
I'm basically from Gulbarga, ma'am, Karnataka. I am Karim's friend.
Okay. Yeah. Okay. Understand. Yeah. So Abdul Karim, na?
Yes, ma'am. He is my batchmate of BPharm.
Understood. Yeah. Okay. Anything else, children?
Ma'am, can we write DH exam without the experience as a fresher?
Yeah, you can write. That's what I said. No, for BPharm students, the best thing to do is get the DHA license, right? Once you get that exam cleared, then while working itself, you can write the exam, because it is not compulsory to do data flow, right? All you need is you need to have your registration done, right? Just get that registration certificate and pass certificate. If you have that, you can write the exam. Its 5-year validity is the most attractive thing, na? DHA has it, other exams don't have it. Saudi and all, you must have the experience first, only then you can think about writing the exam. Clear? Who asked the question? Fatima? Ano choicha?
Clear, ma'am, clear.
Right. Anything else? Okay, right. So I'm going to give you the course description, right? So we provide a course which in 6 months, okay, the course expands 6 months, but everything will be covered within 2 months, right? So you will be given extra 4 months time to, if you want, you can sit in the live classes again, right? For 3 times. Understood? So that doesn't mean that you have to sit. I'm just telling you that even if you miss a recorded class, sorry, a live class, you can sit again in the next round, right? So we provide notes, right, which are focused and topic wise, right? Live classes, 44 live classes will be there. Apart from that, there will be 30 plus recorded videos. Okay, all these are on the topics which are important. Okay, like, right, and after each live class, you will have a topic wise test to do based on that topic, right? So like we had for ethics, similarly, such questions will be there, which will test, how your understanding, how much you understood, okay, each topic, right? Now suppose you after one live class, you have to go and attend the recorded class and study that also, no? In case you have a doubt in the recorded session, right, recorded video, you can always come and ask the doubts during your live session, because we have live classes Monday to Friday. Okay, Monday to Friday, right? Now the timings are, in the morning you will have it from 6 a.m. to 7:30, right? In the evening it is from 7:30 to 9, right? Morning batch is going to be Malayalam, right? And the evening batch is going to be in Hindi bar English, right? Depends if nobody is there from the south, I mean from Kerala or from Tamil Nadu, the session will be taken in Hindi, right? So language preference will depend upon the students who are attending the evening session, right? But the morning session will be taken in Malayalam only, right? So this will go on for next 2 months, right? After that, it will shift. That is, the English batch will be taken in the morning and the Malayalam batch will be taken in the evening, right? So every 2 months it shifts, right? So if it doesn't matter what your preferable time is, right? You can attend it in that 6 months time. You will get your preferred time, right? At least once, right? So we have done it because all people, most of the students who join are working people, right? And they have their duty times are very much different, right? So And all the live classes, the recordings are also available, right? So in case you miss a live class, you have to go through the recording, right? So that you should stay in track with us, right? You don't lose out on anything, right? Now, if you don't understand anything in the topic, you can always come and ask, right? So after every live class, we sit and discuss the topics, right? So all your doubts are cleared. If I know, I'll tell you then and there. If I don't know something that you ask, right, I'll refer and tell you the next day, right? If I couldn't find out, we'll together find it out. Okay. So this is a very tough exam. Okay. So you have to understand that nobody knows everything, right? Even I don't know. I have almost 4 years of experience right now in this teaching field. Still, I find certain topics which are not that easy, right? So you will understand that when you actually start preparing, right? We have to sit together and find out the answer of some questions. Most of it, I'll do the research and tell you, right? So I'm being honest with you, right? If I say, I know everything, I'll be lying, no? Right? Now, so, and we also, I said 44 live classes are there, no? So after every 20 live classes, we'll have 2 classes, that is 1.5 hour plus 1.5 hours, completely dedicated to previous question discussion. Now, these exams are CBT, means they are computer-based test. Any child who goes and writes the exam will not get a question paper. Okay, will not get the question paper. Then how do we get a previous question? We get the recalls. Recalls means we'll ask the students who have written the exam to tell from their memory what came in the exam. Understood? So they tell us the questions which came, right? So recently Vishwanath wrote the exam. He has given us almost 85 to 90 questions, right? Which he remembers, right? So that are very important things, right? Because these are the questions that have come in exam, right? So we will, so these your discussion, this discussion which will be there for 2 days after every 20 classes will be based on these questions. Okay, they are not random questions, right? Now apart from that, you will also have mock test, right, which will help you to what do the time management, everything. So when a student actually go and write the exam, I usually tell them not to waste their time on calculation. You may get 7 to 8 calculations, right? So if you see calculation, skip it there. Don't sit on that, because when we start doing calculation, you might get that right, but the time it takes might be a bit long, right? And you may not be able to even read the other questions, right? So flag that question, go and do all the other questions, come back and then solve the calculation. Okay, that you have to keep in mind. Otherwise, you will not be able to complete the exam in that stipulated time. Okay, clear? Understood what I said? These are the things that we give, right? Now, so we give study materials, right? Plus recorded classes. So these are everything available online, right? So you will have the notes online, okay, through app, right? Test of each and every topic, non-live recorded videos, pre-recorded videos of non-live classes, then mock test, live recorded videos, right? So all this is available for 7,000, right? Now what is extra in the 10,000 package? Live classes through Zoom every day, Monday to Friday, right? If you're preparing for pharmacy technician exam, you will have classes on Saturday mornings also, right? Now there are certain topics from where the questions have started coming for a pharmacist also, like from sterile compounding also the questions are coming, which used to come for only technicians. So if such a topic is there, I'll ask you to sit for the Saturday classes also. If it is not there, I won't, right? Normally you don't have to sit, but if such topics are coming, right, which you also need.
Ma'am, same syllabus in Qatar exam, DHA exam.
हाँ, अब मैं बताती हूँ.
Syllabus are same.
सिलेबस नहीं है, टॉपिक सेम. बी फार्म हमने सभी ने एक ही जगह से पढ़ा ना, एक ही चीज पढ़ा है ना. बी फार्म में सबने कॉग्नोसी पढ़ा है, सभी ने फार्माकोलॉजी पढ़ा है ना. So the basics remains the same, right? The questions that come are different. Question मतलब framing is different. Understood? Right? The concepts, everything remains the same. So class is to make your concepts very strong. ना जैसे कि अभी हमें अभी हमने एक क्वेश्चन लिया था ना क्लिनिकल साइंसेस में, right? Then that what we studied. We studied that if triglyceridemia, somebody has triglyceridemia, the 2 classes of drugs that you can give is what? Niacin and fibrates, right? That doesn't change.
Niacin.
Niacin and fibrate, right? And if somebody has hypercholesterolemia, what do you give? You give statins, you give ezetimibe, right? So the question might be different. Like, अभी एक में पूछ लिया कि high intensity है, somebody has what atherosclerotic cardiovascular risk of say 20%. Okay, we call it 20% risk है atherosclerotic cardiovascular disease आने के chances. Okay, if it is 20%, what you need to give? Okay, so in that case, you have to give high intensity statin. And we know, as you said, no, high intensity statin, 80 mg atorvastatin is high intensity. So that is the answer.
Simvastatin.
Atorvastatin, 80 mg is high intensity statin. If somebody has 20% risk, you have to give high intensity, right? That might be,
Moderate, ma'am, simvastatin. Moderate. In
हाँ
case of moderate.
क्या 20 है, 20 is high. अब क्या कह रहे हो, मुझे नहीं आया समझ में. Can you repeat what
In
you said?
case of moderate, ma'am,
Moderate is how, what you're asking me the dose? It is 10 to
at
20.
simvastatin
का
50 mg.
कितना?
Ma'am,
हाँ
10% risk में, ma'am.
10% रिस्क में कितना होना चाहिए, यू आर आस्किंग?
40 mg, ma'am.
कौन सा वाला?
Simvastatin, ma'am.
कौन सा ड्रग, कौन सा है?
Statin, ma'am, statin.
स्टैटिन में काफी सारे ड्रग्स आते हैं ना बच्चे.
Yeah.
हाँ तो
Simvastatin.
सारा स्टैटिन नहीं, हर स्टैटिन का अलग होता है. हाई इंटेंसिटी में
जी.
सिर्फ दो ही जाते हैं, अटोरवा और रोसुवा. अब
Moderate पूछ रहा है, ma'am.
मॉडरेट में अटोरवा भी आता है, रोसुवा भी आता है, सिम्वा भी आता है, प्रावा भी आता है, पिचावा भी आता है, काफी सारे आते हैं. समझ रहे हो आप? उनका डोज अलग होता है. रोसुवा एंड अटोरवा स्टैटिन्स ना, दे आर हाई पोटेंट टाइप.
Potent, most potent.
Most potent is
Most
Rosua.
potent.
Most potent is Rosua. After that, it is
5 mg, ma'am. 5 mg.
no, 5 mg is not high intensity.
Maximum 10 mg.
अब क्या कह रहे हो? Listen, let me talk. Okay, Rosua 5 mg is moderate intensity. The same Rosua 5 to 10 is moderate. Okay, 20 to
Yes, ma'am.
40 is high intensity. Clear?
Yes, yes.
Right? High intensity. Now, Atorva 10 to 20 is moderate, right? 40 to 80 is high intensity. Understood? Right. So based on that, question can come in Qatar. You might find DHA, they are asking myopathy, which enzyme is elevated. So such differences you will see, but the concept at all now will remain the same. That's what I was saying. Clear? Hai?
Yes. Yes.
Right? The theory that we have to learn is the same, but they will ask everything in a twisted fashion. Right? They won't ask anything directly. Right? So they will give you unnecessary informations a lot. Now you will be confused what I need to. Right? So question will be hiding somewhere in that 5 to 6 lines. Right? So that you have to identify. That is the challenge. Clear? And that is where we lose our time also. Questions are very long. They make it to make it tough. Understood? And the options that they give, when you look at the options, everything seems right. There's another problem. Clear है? अभी आपको दे देंगे अटोरवा. We know that, for example, Rosua 20 mg. Okay, 20 mg, we know it is high intensity. You might be given Rosua 5 mg, Rosua 10 mg. Okay, together. Now you're confused. Rosua is there in high intensity. How much dose is that? Right? So such things they do. Clear? Okay. It will be better if you ask me, right? So yeah, sir has given you the answer. Yeah. Okay, so study materials, live class and mentor support, will have to pay 10,000, right? All this is valid for 6 months, right? 6 months. So in 10,000 package, you will get the previous question answer discussion, right? Which you won't get in the recorded video, only the study materials plus recorded classes. Okay, previous question answer discussion. Mentor support means you can ask doubts, right? Through WhatsApp, 9 to 5, right? Every day, also in live classes, right? Morning, evening, whatever you're attending, right? Those who can understand English and Malayalam, they can sit for both the sessions. There is no problem, right? Otherwise, you will have to sit for the evening session, right? Now, the recordings are also available in English, in Malayalam, as well as a few sessions are also available in Hindi. Okay, right? We're making it possible. We make it possible on days when, as I said, from students from Tamil Nadu are not there. They don't understand Hindi. Yes. So you can ask your doubts. Doesn't matter which language I'm taking in. You can ask your doubts in the language that you prefer. Right? English, Malayalam, and Hindi. Not in
Ma'am, I
other
have one
languages.
doubt.
Ask, Fatima.
If I clear the DHA exam, then I get the job immediately, or I have to work as a trainee for 2 years?
If you clear the DHA exam, sir will answer. Sir. Jabir sir will answer. Yeah.
cleared DHA, and if your data flow is done, then you can directly join the pharmacist.
Is the doubt clear? If your data flow is done, sir is saying if your data flow is done, you can work as a pharmacist. If it is not done, then you can work as a assistant, as you said, trainee pharmacist. Then you will have to work. That means you
The
need
data flow requires 2 years of experience, right?
yeah. For doing data flow, you need 2 years experience.
Can I work as a trainee in Dubai? I can get the 2 years of experience, right?
Yeah, that is possible, sir.
The data flow.
ഇവിടെ തന്നെ വർക്ക് ചെയ്യണമെന്നില്ലല്ലോ ദുബൈയിലായാലും പോരെ ഹലോ സർ
Ashley, sorry, answer കിട്ടിയായിരുന്നോ?
ആൻസർ കിട്ടി. കുട്ടി ചോദിക്കാണ് മറ്റേ ദുബായിൽ വർക്ക് ചെയ്താലും മതിയോ 2 വർഷം?
ദുബായിൽ വർക്ക് ചെയ്താൽ പോരാ,
ഇവിടെ തന്നെ വർക്ക് ചെയ്യണം.
ഇവിടുത്തെ എക്സ്പീരിയൻസ് വേണം.
അവിടെ 2 വർഷം വർക്ക് ചെയ്തിട്ട് അവിടുത്തെ എക്സ്പീരിയൻസ് വെച്ച് ഡാറ്റ ഫ്ലോ ചെയ്യാൻ പറ്റില്ല.
പറ്റില്ല.
Okay, cannot do. See, you must have the experience here itself in India. Okay, working there will not be counted. Clear?
Okay, ma'am.
Right. Okay. Any other doubts? So our new batch night starts on 1st of December, right, on Monday. So if you want to join or if you have any queries, you can call this number which appears on the slide, right? 701-288-1264. Yeah. So I'm winding up the session. If you have any doubt, you can ask.
For example, if a fresher he has no idea about which country to target, ma'am, I think which in your opinion, which would be the best country to target for this exams? In
European
Gulf.
countries.
No, in Gulf only.
Gulf.
Among the one which you shown, like 6 to 7 names.
नहीं, आपने कौन सा किया हुआ है? आपका क्वालिफिकेशन क्या है?
My qualification is I have passed Master of Pharmacy in Pharmaceutics in November 2024, 1 year ago. M.Pharm with 1 year experience.
So you have done M.Pharm in Pharmaceutics, no?
Pharmaceutics, yes.
Yeah. So to be saying it frankly, no? See, Qatar, you don't have to write the exam, right? DHP, you can write the clinical pharmacist post, right? You can write because you have the master's degree, no? You can write the clinical pharmacist. Now, if you go
again after writing, I have to wait for 2 years, ma'am, for DHA.
नहीं, आपको 2 साल की जरूरत नहीं है ना, 1 साल और ना.
Because they will ask when did you take the experience and when did you completed your masters.
No, not after masters, child. That is there. That should not coincide. Your masters and your B.Pharm, your experience should not coincide.
Experience, yes.
Or that is there, but otherwise you can hide your M.Pharm and show your B.Pharm and then 2 years of experience and work as a pharmacist.
So, in your opinion, Dubai is best, ma'am?
नहीं, अगर आप दुबई का एग्जाम लिख भी लेते हो ना, वो आप एग्जाम अभी लिख सकते हो, right? One advantage. You don't have to wait.
Yeah, I cannot. What I can do is I will hide M.Pharm. I can show on B.Pharm because in the February 2026, I will complete 2 years of State Pharmacy Council registration.
That's what I'm saying. Na? Then during that time, you can prepare for the exam also, right? And by the time your experience is done, your examination preparation will also be done, na? Right? So both will happen simultaneously, right? You can do that. Now, अगर आपको थोड़ी देर बाद लगता है नहीं DHA नहीं चाहिए था, let me go and work somewhere else, you can convert it to MOH or to HAD, na? Yes, that is there. Now, after 1 year, you feel नहीं अब कोई और एग्जाम लिखना है, उसके लिए तो आपको anyway you have to wait till your data flow is done, na?
Yes.
Right? So you have to wait, right? Now in Saudi, because we have done B.Pharm, M.Pharm, we can only write technician exam, and only pharmacy people can write the pharmacist. Right?
Yes, SPLE.
हाँ, तो वो आपके लिए दुखदाई होगा ना थोड़ा.
One more doubt, ma'am. I have already completed 1 year with M.Pharm. The remaining 1 year, can I work as a trainee in Qatar, ma'am, to complete 2 years of my training period?
Qatar, sir will answer. ഖത്തറിന് 3 വർഷം വേണ്ട സർ എക്സ്പീരിയൻസ്.
ഖത്തറില് M.Pharm കഴിഞ്ഞിട്ടാണെന്നുണ്ടെങ്കിൽ വേണ്ട, ഡയറക്ട്ലി, അതായത് B.Pharmന്റെ 2 year എക്സ്പീരിയൻസ് വേണം. അത് B.Pharm കഴിഞ്ഞിട്ടുള്ള 2 year ആണെങ്കിലും കുഴപ്പമില്ല. ഓക്കെ ബിഫാം
Sir, English
ബിഫാം
പറഞ്ഞോളൂ.
കഴിഞ്ഞിട്ട്
Maruf ആണ്.
രജിസ്ട്രേഷൻ ബിഫാം കഴിഞ്ഞിട്ട് രജിസ്ട്രേഷൻ കഴിഞ്ഞിട്ടുള്ള 2 ഇയർ അവന് എക്സ്പീരിയൻസ് ഉണ്ടെങ്കിൽ എംഫാം കഴിഞ്ഞ ഉടനെ എന്ത് ചെയ്യാം, ആൾക്ക് പിന്നെ ഖത്തറിൽ പോവാം.
ഉം. ഉം.
ഓക്കെ,
Okay.
എന്നിട്ട് അവിടുത്തെ ഇതിലിപ്പം നേരത്തെ ചോദിച്ച ചോദ്യം ഈ ചോദ്യം നമ്മൾ എന്താ മാറ്റാ അറിയോ?
ആ.
അപ്പൊ ആ കുട്ടി ചോദിച്ചില്ലേ അവിടുന്ന് 2 വർഷത്തെ എക്സ്പീരിയൻസ് ഉണ്ടാക്കിയാൽ മതിയോന്ന്,
DH ഉണ്ട്.
DHന്റെ അത് കിട്ടൂല. കാരണം എന്താ വെച്ചാൽ കുട്ടിക്ക് ഫാർമസിസ്റ്റ് എന്നുള്ള ഒരു ഡിഗ്രി കിട്ടണമെന്നുണ്ടെങ്കിൽ അവിടെ രജിസ്ട്രേഷൻ കഴിയണമല്ലോ.
ആ.
അവർക്ക് എക്സ്പീരിയൻസ് കിട്ടുക ട്രെയിനി ഫാർമസിസ്റ്റ് എന്നായിരിക്കും. ഈ ട്രെയിനി ഫാർമസിസ്റ്റ് വെച്ചിട്ട് നമുക്ക് ഡാറ്റ ഫ്ലോ ചെയ്യാൻ കഴിയില്ല.
ഓക്കെ, മനസ്സിലായി.
അപ്പൊ അത്രേ ഉള്ളൂ അതില്. ഇപ്പൊ ഇവനാണെങ്കിൽ ഫാർമസിസ്റ്റ് എന്നുള്ള എന്ത് കിട്ടും, എക്സ്പീരിയൻസ് കിട്ടും.
എവിടെ കിട്ടും?
ഇപ്പൊ ഇവൻ ഖത്തറിൽ പോവുകയാണെങ്കിൽ എംഫാം വെച്ച്
അവിടെ കിട്ടും.
ഖത്തറിൽ പോവുകയാണെങ്കിൽ
എന്നിട്ട് ഇവിടെ തന്നെ ചെയ്യേണ്ട
ഫാർമസിസ്റ്റ്
ആവശ്യമില്ല, അവിടെ നിന്ന് ചെയ്താൽ മതി.
ആ
മനസ്സിലായി.
അപ്പൊ ഫാർമസിസ്റ്റ് എന്നുള്ള എക്സ്പീരിയൻസ് വേണം നമുക്ക്,
മനസ്സിലായി.
എന്നാലേ ഡാറ്റ ഫ്ലോ ചെയ്യാൻ പറ്റുള്ളൂ.
Okay. So, Maruf, you
Yes,
have
ma'am.
1 year
I'm listening.
experience now after MPharm.
Yes, after
Yes,
MPharm.
right. After MPharm. Now, if you want, you don't have to write the exam. You can just go to Qatar and start working there as a pharmacist, right?
Okay.
There you can complete your 2 years. Understood?
Then after that, I can do my data flow after 1 year. That is in the end of
There is no
2026.
need to do that. That will be considered, right? Anyway, you don't need to write the exam. Qatar.
Okay.
Right, and because see in DH, when students write their B.Pharm and go there, they will be taken in as a assistant pharmacist, na? Understood? Right, but because you have done M.Pharm, when you go to Qatar, you will be treated as a pharmacist, right? And
Yes.
we need the experience as pharmacist, not as assistant pharmacist,
Okay.
for data for when you have to do.
So I can work.
How you can work without writing the exam, Qatar. If you want to go to Qatar, but if you want to work in
Okay.
Dubai, you have to write the exam. But
Better thing what I look is because even there is a time and even there
there
is
are
some
multiple students who write multiple
multi
different exams.
yes.
They do that. So
So
they keep it in
so
hand.
that's why yeah.
No, I have seen students who write the clinical pharmacist for Qatar as well as for DH. Understood? It's
Yeah.
because they want multiple opportunities. Because once you prepare, once you are prepared, you can a little bit difference is only then, right? So if you keep
Yes, ma'am.
it cracked, it is easy. We will have multiple options to go to different countries. All you have to pay is what? A little bit money, 50,000. Yeah.
Yes.
Because cracking exam is more tough than making money.
Yes.
You can make money anytime, right? But cracking is difficult.
So yeah, ma'am, again asking what's your opinion, ma'am? Which exam should I consider?
You see, the Gulf scenario is changing. Jabir sir, ഏറ്റവും നല്ല country പോവാന്.
Today's ഇന്നത്തെ സാഹചര്യത്തിൽ it's better to opt to Dubai.
Dubai. Okay. Dubai is better.
The all other opportunity is very less.
He's telling you
And
frankly.
salary
there's
is also Qatar is also not paying much salary right now. And opportunity is very less.
Okay.
Yeah. So Dubai is better.
Can I work as a trainee pharmacist in Dubai without writing the exam? Can I get easy as a trainee pharmacist?
Without writing the
Actually,
exam. Sir. Sound break out.
പ്രശ്നം എന്താ വെച്ചാല്
ആ.
എനിക്ക് നിൽക്കേണ്ടി വരിക.
എന്താണ്?
ക്ലിയർ ആണില്ല? ഇപ്പൊ ക്ലിയർ ആണോ?
ഇപ്പൊ ക്ലിയർ ആണ്. പറഞ്ഞോളൂ.
ഇപ്പൊ ക്ലിയർ ആണോ?
ഇപ്പൊ ക്ലിയർ
ആണോ?
ആണ്.
ഇതിന്റെ ആ കുട്ടിയുടെ പ്രശ്നം എന്താ വരിക എന്ന് വെച്ചാല് പിന്നെ കാലാകാലം ആ കുട്ടി ട്രെയിനി ആയിട്ട് നിൽക്കേണ്ടി വരും. ആ ട്രെയിനി ആയി കഴിഞ്ഞാൽ പിന്നെ അവർക്ക് ഫാർമസി ഇതിലേക്ക് മാറാനും ഭയങ്കര പ്രൊസീജിയേഴ്സ് ആണ് വരിക. ഓക്കെ, പിന്നെ സാലറി കുറവായിരിക്കും. ആ സാലറി കുറവായിരിക്കും. ആ സാലറിയിൽ നിന്ന് മാറൂല. അപ്പൊ ഒരു 2 വർഷത്തെ പ്രയാസം ഉണ്ടാവുള്ളൂ. Experience all this from here, sir.
Fatima, what sir is saying, see, if you go and work there as a assistant pharmacist, you might get a job there. But the thing is, the salary that you will be paid will be very less. Understood? And then you will have to work lifelong as an assistant pharmacist. But if you wait here for 2 years and get the experience, then there you can work as a pharmacist. So there will be growth, professional growth. But if you go and work there as an assistant pharmacist, you will remain as an assistant pharmacist because for getting the data flow done, that experience will not count. and you'll be paid very less money also. So in long run, it is not going to help you build your career. Na? Clear, Fatima?
Ma'am, as a training pharmacist, if I work 2 years in that Dubai as a training pharmacist, that will calculate as a
No,
2 years
that will not be
experience.
calculated as a experience because you need 2 years experience as a pharmacist. Na? And without the data flow, you cannot work as a pharmacist there in Dubai.
Okay.
Clear, na?
Okay.
Okay.
Ma'am, for SPLE, it is compulsory to have 1 year of experience.
Yeah, you need to do the data flow first and then you can, or then only you can write the exam. Na? For SPLE.
Yes, ma'am. In data flow, they have mentioned like experience or without experience.
It's not gonna possible.
I have completed
No.
BPharm plus PharmD. I have completed 1 year of internship, ma'am. 1 year of training. So I
1
can be
year
eligible or not.
So 1 year
Definitely.
internship madhya.
No. They need to get 1 year experience as pharmacist.
Either in
There
hospital
is,
or in the community.
yeah, whatever may be no problem. But there is a format for the experience also. If you want, we can share itself.
Yeah.
It's compulsory to have 1 year. 1 year they are counting sometimes from the date of registration.
So to be at the safe side,
Okay.
1.5 years.
Ma'am, I have registered like BPharm I have registered. Or that my register number is there for like I have completed
No
BPharm,
problem.
I have that and registered. And
No
I
problem.
have done PharmD PB.
Post bachelor sir
What will be counting?
Post bachelor role എഴുതാൻ പറ്റുമോ SPLE pharmacist
പോസ്റ്റ് ബാച്ചിലറായിട്ട് ഒന്ന് ചോദിക്കണം. I will
post
check.
bachelor we will inquire from the accurate resources and tell you. Abbas, just send me a hi message in the number that I used to post. No, I'll just you can just a second. Jabir sir number okay. Give me a second, I'll tell you the number. That is the academic number. Just send a hi message in that. Okay, you have done post bachelor, right? No?
Yes, ma'am.
We'll get back to you. Right. Okay. Just
Okay,
write down the number. It's 89 211
211
96187. Yeah, I have written that. See, 89 211 96187. Right. Just send a hi message in that, right? With your query, we'll get back to you. Okay, can't just say anything.
Okay,
No?
ma'am. Thank you.
Right.
Yes, ma'am.
Otherwise, they can ask in the group also.
Yeah, you can ask in the group also. In whichever group you are, no? You
Okay,
join
ma'am.
through group only, no? Right? You can ask in the group also. No
Yes,
problem.
ma'am.
Right. We'll get that
Okay, ma'am. Thank you.
cleared. Anything else? So if not, we'll wind up.
Good evening, ma'am.
Sneha, ask. Where are you from? Tell me the place and the exam you're preparing for. It will be easy, no?
Present, I am in Kuwait, but
Cool.
I am from Telangana.
Telangana. Right. Okay, fine. Ask. And which exam you're preparing for?
MOH for Kuwait, ma'am.
Okay. Kuwait, we don't provide child. Okay, ask.
Yeah, Kuwait totally different scenario.
Yes.
Okay. അപ്പോ
I done MPharm in pharmaceutical chemistry.
Okay.
Recent passed out. I came here. Without experience also eligible to write exam?
Where? You're in Qatar?
No, Kuwait.
Kuwait.
Sir will explain.
Sneha, it's Kuwait is the totally different scenario. Okay. That we need to discuss a lot. No problem. You can you're joined through our WhatsApp link, right?
Yes.
You're in that group, no? You can send messages if you have
You
regarding.
just send a message regarding your query. We will answer you correctly. Okay.
Okay.
Kuwait, we don't provide coaching here. This scenario is completely different, right? So they have a little bit of Arabic and everything there. So that's why we don't provide coaching. Okay, so whatever your query is, no, you post that in the group. We'll get it answered. Okay, just give us a couple
Yes.
of time, right? We have people there,
Okay.
but the thing is, we need a bit time, right? So respect that. We'll get back to you. Okay, Sneha?
Okay. Thank you.
Right. Anything else? Okay. If it is not there, we are winding up the session, right? One more thing. If anybody joins today, na, you'll be given a 500 rupees off, right? On the packages, right? These two. Our batch starts on December 1st, right? So if you want to join, do call on the number, right? Which appears at the bottom. See this one, right? So in case you join, I'll see you in class. Otherwise, thanks for joining. Yeah. Thank you, everyone. Thank you, sir. Mind DLA. Okay. Thank you, everyone.